We are at a critical juncture with respect to our healthcare system here in the United States. Arguably, our healthcare system is flawed, if not outright broken. All in, our healthcare system accounts for nearly $4 trillion in spend annually, nearly 20% of our GDP. So if an entity is positioned to bring about meaningful change, it has to be one that's been providing innovative health and travel risk services to consumers, enterprises, and governments for 12 years and counting in some of the most extreme circumstances. Global Rescue is an innovative, visionary company. It set about providing much needed health and travel risk services for members quite simply because there was a void for services like that. What started out with a much needed idea designed to meet the needs of the post 9/11 traveling public has blossomed into a geographically dispersed company with operation centers around the globe serving more than 1 million members. What's more, Global Rescue has forged exclusive partnership arrangements with some of the leading medical systems and providers, not just here domestically, but arguably throughout the world with its partnerships with Johns Hopkins Emergency Medicine Division of Special Operations, Elite Medical Group, and Partners Healthcare, which includes Harvard Medical System. All too often, businesses tout their global reach. Well, Global Rescue has routinely performed operations in the farthest reaches of the globe, quite literally. Over the span of the last 10 years or so, we've had some incredible examples of innovative companies disrupting segments of our domestic and global economy that on the surface didn't necessarily appear as though it was ripe for change or disruption. Think of this, until only 7 or 8 years ago, when you needed to hail a cab, you stepped off a curb and threw your arm in the air. And if you were lucky and it was the right time of day, a cab pulled over and you jumped in and off you went. Well, along came Uber, and together with technology and an innovative app, you can now tap a button and get a car to come to you where you are, when you need it, and take you where you want to go. No need to exchange money. Your credit card is already pre-programmed in the app. It took Uber nearly 6.5 years to hit the 1 billion ride mark, and another 6 months to double that to 2 billion. And Uber's estimated value is north of $60 billion, and they don't even own any vehicles. Similarly, disruptive players have emerged on the social media front with the likes of Facebook and Twitter and Instagram, on the retail front with Alibaba and Amazon, and in the lodging arena with Airbnb. All of these innovators saw a need for disruptive change in everyday areas of our lives. What could be more everyday than hailing a cab, or communicating with friends and coworkers, or buying goods in a retail setting, or securing overnight accommodations? Well, let me ask you this. What could be more everyday with the notion of disrupting how we go about accessing high-quality healthcare at a cost that we can afford, not only today, but tomorrow and 6 months from now and a year or more from now? Would that be disruptive? How about the timing? Would that be needed? There's an old saying, a picture is worth 1,000 words. Well, think about the pictures these numbers conjure up. Our healthcare system is incredibly broken, and it has been for quite some time, decades actually. We're now waiting nearly 20 days to get an appointment with our primary care physician. And once we're there for 2 hours. And of those 2 hours, only about 8 minutes are spent in the presence of our PCP. So, access to the system is broken. And the quality of our experience is anything but high, or for that matter, acceptable. Unfortunately, this is our reality, and it's been on a downward slope for the last 25 years. To make matters worse, the cost of the care is high and going higher at a pace that's not only unacceptable, but also unsustainable. The average cost for an emergency room visit already exceeds $1,300, and the average cost for a PCP or urgent care visit is $150. But here's the real catch. We are so conditioned, and have been for years now, As consumers of healthcare, we run off to our doctor's offices, or more recently, urgent care centers, and now hospital emergency rooms, whenever we feel as though we need the care of a doctor. And in almost 3/4 of the cases, the visit to the emergency room wasn't even necessary. Let me repeat, in nearly 3/4 of those cases, the visit wasn't necessary, and the bill for that visit was, on average, more than $1,300. So the question becomes, do you want to be part of a solution to this broken $4 trillion healthcare system? All too often, and for far too many years now, the proverbial tail has been wagging the dog as it relates to our healthcare system. For the last 2 or 3 decades, we have been enduring a continuous degradation of our healthcare system. Regardless of whether we're an employer who provides healthcare benefits to our employees, an employee who gets healthcare coverage through our employer, or a dependent who relies on a healthcare benefit being offered to a spouse from their employer. Access has been getting more and more convoluted. Quality has declined immensely, and the overall costs have skyrocketed. And the cost shift from employer to employee has been dramatic, all in an effort to maintain the ability to continue to offer some form of a healthcare benefit. Enough is enough. Global Rescue, like some of these other disruptive examples, has simply said enough is enough. And there has to be a better way to access high quality healthcare, all the while at a price that is affordable. Like these other disruptive examples, the market demand and need for change in healthcare is ripe, and the technology is available to change the paradigm in a significant way. We call our solution TotalCare. It's a virtual healthcare service that provides access to paramedics, nurses, and physicians for urgent consults 24 hours a day, 7 days a week, every day of the year. Wherever you are, whenever you need us, we'll be there for you. No more 20-day wait time for your appointment. No more 2+ hours in your PCP office when you're really only in front of your PCP for an average of 8 minutes. And through our partnership arrangements with Elite Medical Group, Johns Hopkins Medicine Division of Special Operations, and Partners Healthcare, we've assembled a world-class array of medical professionals that are prepared to handle the gamut from routine to complex, even if that should include specialty consultations, second opinions, prescriptions, labs, or imaging. So, as our service's name suggests, we bring you TotalCare, when you want it, when you need it, wherever you are. Over the course of the last several years, going back even as far as 2 or 3 decades, we've become culturally conditioned to call our PCP for things that might not be considered urgent, but nevertheless are causing us some concern. Further, that cultural conditioning transcends to regular urgent care and emergency room usage for conditions that arise unexpectedly or at a time that is otherwise inconvenient, like in the middle of the night. As I showed earlier, nearly 3/4 of emergency room visits are unnecessary, and they're not cheap. So the real challenge for this disruptive solution to take hold and change our decades-old cultural conditioning is to call Global Rescue first. Think of Uber, and more specifically, the Uber app. Do you think Uber would be valued in excess of $60 billion if all people did was load the Uber app on their smartphones, but then never touched the button calling for a ride? No, they never would have amassed in excess of 2 billion rides in just over 7 years. Well, similarly and together, we can and will make a much needed difference in the challenges to improve access and quality in our healthcare system, all the while reducing cost by contacting Global Rescue first for common conditions and even more complex issues of concern. Global Rescue's team of medical professionals is prepared to help you with your medical needs 24/7, 365, regardless of what your needs and concerns are. Obviously, not everything can be addressed in a virtual setting. If you're dealing with a life-threatening emergency, by all means, call 911. And if you should contact us for a condition or circumstance that is best handled in person, we'll suggest as much and can assist you with the connection to a proper care provider. As we've said, our healthcare system in the US is largely broken. The timing couldn't be better for a comprehensive virtual healthcare service to come on the scene. However, delivering on the promise of making access to high-quality virtual healthcare at an affordable price, 24/7, 365, it demands leading-edge technology, not only to make the connection between you as patient and the TotalCare medical professionals, but also to help us understand some vitally important biometric information so that our care professionals can best understand what is going on with you and your body at that very moment. Therefore, key to accessing our TotalCare solution is our mobile app that is designed to work from your smartphone for real-time medical consults or even video consultations if they're necessary. And to help our medical professionals replicate what takes place in an actual doctor's office visit, we are arming our TotalCare members with a body metrics device that tracks and records your vitals, including pulse oximetry, heart rate, EKG, systolic blood pressure, and your body's temperature. All of this information can then be downloaded to your electronic health record. In essence, in order for our medical professionals to deliver a meaningful virtual health consultation, they need to fully understand what's going on with your body. The body metric device is a tremendous tool for just that purpose. So let's take a look at some more numbers and try to put this value proposition around the virtues of a virtual healthcare visit in perspective. A typical family of 4 encounters 12 PCP or urgent care visits in any given year and an additional 2 emergency room visits. At $150 per PCP or urgent care visit and more than $1,300 on average for an emergency room visit, that's over $4,400 paid by the family. Those are costs that are likely not covered by the family's health insurance plan. Why? Well, the average Silver Plan annual deductible, and that's the Silver Plan from the Affordable Care Act, is $6,000 or higher. So all of that care for 12 PCP or urgent care visits and 2 additional ER visits, all of that won't even hit the deductible of the health insurance plan. Alternatively, if that same family of 4 were TotalCare members, a typical year for them might include 12 virtual consults with our medical professionals, no visits to the emergency room, and a few face-to-face visits to their PCP or urgent care center. This new reality, this new disruptive reality, would save that family of 4 over $3,000 that year. Further, families like this one can start to rethink their health insurance options. Assuming they can recondition themselves to call our medical professionals first, rather than to rush off to their PCP or urgent care center, or worse yet, the emergency room, for things that could and should be handled virtually, then they can also consider buying down to a lesser health insurance plan, a plan with higher deductibles and lower costs to them. Those savings will be above and beyond the actual savings realized by avoiding unnecessary care in an inappropriate setting. Plain and simple, this is the essence of disruptive technology at a time of incredible need. The overarching economic principles for a virtual healthcare solution like TotalCare apply to individuals and businesses alike. Let's face it, most Americans get their healthcare coverage through their employer. So if that family of 4 can save significant money by embracing TotalCare, so too can employers who are largely the ones that are sponsoring and paying the lion's share of the benefits costs. Let's look at some more numbers, and these are equally shocking and compelling. Employers are spending on average more than $6,200 per year for an individual employee's healthcare coverage. The annual spend is almost 3 times that for families, more than $17,500. If that's not bad enough, in the last 15 years, employer healthcare costs have tripled. And finally, as the Affordable Care Act continues to demonstrate that it is anything but affordable, annual cost increases are regularly in the double digits, forcing employers to continue to push more cost and more burden down on their employees. Sadly, healthcare benefits could be referred to as healthcare hassles. Regardless of whether an employer is a small, medium, or large employer, it's a safe assumption that they're struggling with their healthcare benefits. The Total Care solution, appropriately adopted, will reduce unnecessary utilization in some of the most costly settings, like emergency rooms. Reduced utilization means reduced cost. Employers can buy less insurance, employees will have less exposure, yielding significant savings for both the employer and the employee. And the cost savings numbers really add up quickly. Even for a company of only 200 employees, the annual cost savings begin to exceed $1 million. In a recent study conducted by Harvard University, the underlying premise of the efficacy of virtual healthcare was absolutely confirmed. Two separate employers, Home Depot and Rent-A-Center, agreed to participate in the study. Home Depot selected 1,300 of their employees to participate in the study, and Rent-A-Center selected 500 of their employees to participate. These subgroups of employees were representative of the overall demographic of these two employers. By that I mean age, sex, family size, health and medical makeup. So said another way, these subgroups were anything but randomly selected. The subgroups were scientifically representative of the overall groups. Of the 1,300 employees participating in the Home Depot study, there were 5,900 urgent care virtual consultations. And of the 500 employees participating in the Rent-A-Center study, there were 3,400 urgent care virtual consultations. Both Home Depot and Rent-A-Center realized a 92% resolution rate for those virtual consultations. This means that in 92% of the instances, whatever the employee was calling about, it was resolved virtually. Only 8% of the instances needed to be resolved and attended to in a face-to-face setting. And as I said earlier, avoided face-to-face encounters, things like PCP office visits, urgent care center visits, and by all means, emergency room visits, means avoided claims for the employer and the employee, and it yields significant cost savings. For these subgroups in this study, the cost savings over a 12-month period to the employer as plan sponsor was nearly $6 million for Home Depot and $1.2 million for Rent-A-Center. A very important factor to consider as it relates to this study is the successful cultural transformation that obviously took place for these affected employees. Back to what was mentioned earlier, for these savings to be realized, the employees needed to behave differently when something urgent arose. They needed to engage with the virtual healthcare service provider first, as opposed to doing what they otherwise would have done if they had not had the virtual healthcare service. I can't stress enough how important that is for an employer to educate their employees that engaging with the virtual healthcare provider first, each and every time, other than a truly life-threatening emergency, is critically important. When that cultural transformation takes place, it will have a lasting effect. Not only will the employer realize significant cost reductions, but go-forward funding levels for their healthcare coverage will be lower, significantly lower. Their employees will realize far better service, 24/7, 365 response to their urgent healthcare issues, without the hassles of making an appointment with their PCPs, without waiting nearly 3 weeks for that appointment, only to spend more than 2 hours at the PCP office, where they're in front of their PCP for only 8 minutes of those 2 hours, and having to pay about $150 for that privilege. All in all, it's time for this disruptive technology and service to arrive and be quickly adopted. Think back even 15 years. Healthcare costs have tripled over that time. Employers have found ways to shift much of those cost increases to their employees out of necessity. The time is right for employers and employees alike to embrace this new virtual healthcare approach.